Welcome and congratulations on being accepted to the Adult Learner Ambassador Program. We are so delighted to have you join our team. Today, as a participant in the Ambassador Program, you will have your orientation. You'll briefly have the opportunity to meet the various team members. You'll also have an orientation to our various expectations and then introductory to concepts that you will learn and hear throughout your participation. While participating in our program, you will have the opportunity to meet many of our team members, including myself, Dr. Weller, as well as Dr. Brown, Dr. Najor-Durek, and Dr. Johns. You'll have opportunities to participate in various trainings that we facilitate or content that we provide. Moreover, you will have the wonderful opportunity to work with our team members, Crystal and Katie. They will be facilitating many of your trainings and your content throughout your participation in the program. As a participant in our program, we have some expectations we want to review with you. First, each week you will participate in weekly modules. As you may already know, this program is self-paced, and so most of the training and content that you will receive is going to be through Canvas. Please follow the directions closely. Katie and Crystal work really hard to provide a lot of detail on how to complete assignments, so please review that first before reaching out. Also, be sure to turn things in on time, both assignments that you'll have in Canvas, as well as the timesheets that you'll be tracking the time that you spend at your volunteer experiential training site. Also, you'll have the opportunity to learn and interact with one another, and most of this will be done via voice thread. So please be sure to be engaged and to respond as asked in voice thread. In addition to the content that you'll receive via Canvas, you will also be expected to participate in about 70 hours of experiential training. These 70 hours, if you're a senior, come from your practicum placement, and therefore you can count those hours that you do in your practicum towards the 70 hours for our program as long as it's in healthcare. Or you may volunteer. Some of you may have worked with Katie to figure out if your work placement, your current work employment meets our criteria. If you do have a healthcare job and you're curious if you can use that towards your experiential training hours, please connect with Katie. But over the course of the time we're together, which is between now and about April, we'll be expected to complete 70 hours each. You will also all be expected to attend mentoring meetings. You're expected to attend 4 of them. You will meet with the same mentor. Some of you may work with me, or some of you may work with other people. Additionally, if there's something you need or there's something that happens that requires a change or an extension or anything like that, we ask that you communicate with us 24 hours in advance. You can always email the Academy to get information and to let us know, again, 24 hours in advance. In addition to our program expectations, we want to let you know that we'll be collecting data from you at various time points. First, and all of you have probably completed at this point, is an entrance survey. We do all of these surveys because it's critical to receiving funding that we gather the data and we get this information so that we can prove to the government that we're doing what we said that we would do. You'll also be asked to complete an exit survey when you finish the program, as well as for your case, you may do a focus group or an interview. I believe for the adult learners, we'll actually be setting that up so you can do one-on-one interviews with our evaluator. Additionally, after you complete the program, we will follow up with you at 6 months, 12 months, and 18 months to see how you're doing. It's very important to us that we see what you're doing and how you're doing and what influence this program may have had on your life. You'll be asked to complete surveys at 6, 12, and 18 months. Additionally, some of you may be asked to participate in interviews. We actually just kind of select various ambassadors to help provide us with this information. Throughout your participation in the program, and we know that when you've completed the commitment letter, you already watched the welcome video that goes over what the learning objectives are, so therefore I'm just going to focus on a couple of key terms. One of the concepts that's really important for us and for helping you understand what's important for our program is we really focus on addressing disparities in healthcare. Disparities in healthcare are when things like access to healthcare, outcomes because of your healthcare, or the quality of your healthcare isn't what it should be. For example, there's study after study that shows various groups, if they live in a rural community, if they live in a certain economically depressed community, or particular specific racial and ethnic groups community, may be less likely to have access to care. or when they receive care, their outcomes may be different and the quality may be poor. And so this we know study after study shows. And in fact, one of the reasons that we put this program into place is because we knew that there were disparities in healthcare across the Tri-County area of Detroit. So where we're trying to move to is get to a point where we can talk about equality and equity. Now, a lot of people will talk about equality, and that's where you see at the top screen, and that's where we give everybody a bicycle, regardless of their height, their ability status, or their needs. They all get the same bicycle. Well, that might not work. For example, if you're in a wheelchair, a bicycle with 2 wheels might not be as efficient for you as opposed to equity, where we give you a bicycle that has a different seat and has 3 wheels that can support you. Or, for example, we may have a different bicycle based on your height. So throughout your time in the program, we really want you to start thinking about equity. How can we ensure that we think people receive care that is equitable? Not equality, but equitable. Additionally, we want to talk a little bit about healthcare. What was really important for you to know is healthcare careers are expected to grow by 10% over the next 10 years in Michigan. So that means regardless of whatever healthcare profession you pursue, be that in social work or other healthcare professions, it is growing and there's a tremendous need. So what is healthcare? You might be asking, particularly what is healthcare social work? Well, it's people and organizations that provide healthcare. And the goal is really to ensure that people's physical, mental, and emotional well-being is performed with high quality of care. Social work healthcare people or professionals work across a variety of settings. They work in nursing homes, behavioral health facilities, mental health facilities, hospitals. They can provide dialysis, or not provide, they can work in dialysis clinics. They can work with individuals with substance misuse. They also tend to work on a variety of different interdisciplinary teams. So when we say interdisciplinary, I mean that social workers may work with doctors or nurses, other social workers, specialists like speech therapists, occupational therapists, you name it. But it's often working across a variety of settings with multiple different teams that are available. Now, as a social work healthcare person, you may provide all sorts of different care. Sometimes you do case management, sometimes it's care coordination, discharge planning, collaborating with various agencies across the area to ensure people get the care that they need. Additionally, when licensed, you may actually engage in assessment and treatment planning. So again, healthcare social workers do a lot across a variety of different settings, working with multiple different professions to ensure that quality care occurs and that people get access to the services that they need. And as you do this work as a social worker, it's critically important that you do this from a culturally competent perspective. In culturally competent care, it assumes that as a provider that you're going to learn a set of skills and attitudes, and you're going to show that you know these skills and attitudes to work across a variety of different cultural contexts. You're going to learn a lot as you participate in this program about providing culturally competent care. In addition to learning about culturally competent care, again, being able to understand a person's culture from what the research says and what the knowledge says and what people's experience says, as well as what people share with them, to also learning to become culturally humble and practice cultural humility. And it's important to understand that cultural competence is sort of seen as like this skill set and knowledge, whereas cultural humility is this process that you'll undergo of being aware how people's cultures can influence their health, their behavioral health and their mental health, and then using this awareness to cultivate a sensitive approach to treating patients. So for example, you will participate in some continuing education trainings that we have developed for you, and it'll talk about how to approach people with an understanding of their culture and how to grow and develop in your cultural humility. Now, these are just some high concepts and terms we want to introduce you to as part of your orientation, but you'll get and dive much deeper into these terms. But again, congratulations. We're delighted to have you join the program.